He was 52 years old, no major symptoms. He went in for a routine dental exam, had bleeding gums, deep pockets. Just floss more, they told him. 2 months later, he had a mild heart attack. And here's what no one told him, that his mouth, it was warning him loudly, because periodontal disease isn't just about plaque. It's about systemic inflammation, and that's the same inflammation that affects the lining of your arteries. Welcome, everybody. My name is Dr. Mark Shankman. I'm an oral and maxillofacial surgeon here at the Obesity Project, episode 76, Bad Gums, Sick Heart, the oral warning signs doctors keep ignoring. So you have to remember, number one, your mouth is the mirror of your body. So your gums are loaded with capillaries and immune system cells. They react quickly to systemic stress. And if you're insulin resistant or inflamed, your gums will often show it before your blood work does. There was a 2017 study in Circulation that found people with gum disease were 25 to 70% more likely to suffer cardiovascular events like heart attack and stroke and things like that, even when controlling for smoking and cholesterol. So, as an analogy, this is like a smoke alarm going off in one room, but the fire is already in the walls. It's already in all the rooms around you. So, inflammation links gum disease to arterial damage. So, when your gums are chronically inflamed, cytokines like interleukin 6 and TNF alpha enter the bloodstream. C-reactive protein, another of these reactive inflammatory mediators, it begins to rise as well. And then the endothelial cells in your arteries, the inner lining cells of your arteries, they get damaged from this inflammation. And this is what accelerates atherosclerosis. I always have a hard time saying that. Even in people with normal cholesterol levels. So there was a 2019 meta-analysis in BMJ Open, which showed that elevated CRP or C-reactive protein levels from periodontal disease or gum disease directly correlated with arterial stiffness and plaque buildup. So this is sort of a real-world clue. And if your dentist tells you your gums look angry, quote unquote angry, your cardiologist should be paying attention as well. So another thing that happens is insulin resistance. There's an insulin resistant connection. So insulin resistance drives inflammation in both the mouth and the arteries. Insulin resistance doesn't play favorites. It's inflammation throughout the entire body. So here's how inflammation or insulin resistance drives inflammation throughout the body. So it promotes oxidative stress, and that's, sort of these oxidative reactive mediators which can mess up metabolic function. It suppresses nitric oxide, which is a chemical which actually protects vessels and helps them dilate. It also impairs healing in vascular and oral tissues alike. So again, the inflammation in the body, it doesn't really care where it is. It doesn't care if it's in your mouth or if it's in your heart. It's in both places. It's throughout your entire body. And there was a 2020 review in Frontiers of Endocrinology, which confirmed that insulin resistance links periodontal disease and cardiovascular disease through shared inflammatory pathways. So here's the practical takeaway. You can no longer treat gums and heart separately any longer. They're both symptoms of the same root cause. And here at the Obesity Project, that's what we're trying to dig out, the root cause of all of these things. And also, here's another thing to consider is that treating the mouth helps your heart and vice versa. So when we treat periodontal disease aggressively, things like C-reactive protein levels begin to drop, endothelial function improves. So the lining of those arteries, their function improves because we're decreasing the inflammatory mediators and we're decreasing the pathogens or the microbes that are present in periodontal disease that are getting into the bloodstream and causing inflammatory changes throughout the body. So there was a 2011 study in the New England Journal of Medicine that showed that treating severe gum disease improved arterial elasticity, so it becomes more stretchable, which is important to prevent blockages by these plaques, and also reduces blood pressure. And it does this in just 60 days, in just only 60 days. This was a 2011 study by Tonetti et al. But here's the catch. If you don't fix the metabolic issue underneath, the gums and the heart, they keep suffering. So let's talk about what actually heals the system. So things like low carb, anti-inflammatory diets, these type of diets improve several things. Really four major players. One, of course, insulin sensitivity. We eat low carbohydrates, we get more insulin sensitivity as we allow insulin levels to normalize, to come down to very low levels. Low levels of insulin produces insulin sensitivity. Very high levels of insulin creates insulin resistance. So low carb anti-inflammatory diets also improve endothelial health, or the lining of the arteries. Also improves inflammatory markers. It decreases all of those inflammatory markers that we spoke about. Just as a reminder, C-reactive protein, interleukin 6, and tumor necrosing factor alpha, TN-alpha. And then it also, low carb anti-inflammatory diets also improve oral tissue regeneration. So it allows the gum, ligament, bone, tooth complex to all regenerate as opposed to just repairing. So repairing creates scarring and creates sort of patching of the body, whereas regeneration is recreating the normal anatomy in the area. So a 2022 pilot study in clinical oral investigation showed that low-carb diets significantly reduced gum inflammation and bleeding, even without changes in brushing habits. So you have to remember what's good for your gums is also very good for your arteries, because when you fix the signal, the inflammation everywhere starts to recede. So this has been episode 76 of the Obesity Project. Bad gums, sick heart, the oral warning sign doctors keep ignoring. So if your gums are inflamed, don't just call your hygienist. Don't just go see your dentist. You may need to call your cardiologist and your nutritionist, because a bleeding mouth could be the very first symptom of a much, much bigger fire. So don't forget, here at the Obesity Project, we're cutting through the myths, getting to the root. Thank you so much for watching. I appreciate you. Like, share, and comment. Hit that subscribe that notification button, the bell notification. Hit all those things. Join us every day on the Obesity Project, and I'll see you in the next video. Take care.